Follow these steps
for a standardized high-quality result with Whistle Glow. Step 1. Surface preparation. Perform thorough ultrasonic scaling to ensure the enamel is free of plaque and calculus. Step 2. Mixing the serum and Prophy paste. In the dampened dish, mix the serum and Prophy paste in a 2:1 ratio until a homogeneous, uniform consistency is achieved. Step 3. The polishing protocol. Start by applying the mixture quadrant-wise using a low-speed handpiece only. As a general rule, do not exceed 10,000 RPM unless you deem a different speed more appropriate for the specific needs of your patient. The sequential polishing protocol is to be conducted in 3 steps. Step 1. Begin with the broad brush to address the labial surfaces, establishing a base level of enamel smoothness. You have an option of 2 broad brushes. A high abrasion white-colored brush that can be used as an option to the surface scaler for removing deep-rooted brown and black stains. The second low abrasion purple-colored nylon brush is an essential part of the polishing protocol. Step 2. Switch to the slim or tapered brush to meticulously treat the cervical margins, interproximal zones, and anatomical contours. Step 3. Conclude with the polishing cup to achieve the final high luster finish and reflective gloss. Use the serum and Prophy paste mixture at every polishing step. The goal is to achieve uniform smoothness without loss of natural texture. Step 4. Applying the Whistle Glow serum. After the polishing protocol is completed, apply the Whistle Glow serum to the tooth surfaces evenly using a cotton bud or a bonding brush, and keep it applied for 3 to 5 minutes. Finish by removing the residue with a water spray, gently air dry, and document the results. Clear patient communication is key to ensuring patient satisfaction. Whistle Glow is an enamel health-first treatment. Emphasize that this is a rejuvenation treatment that is good for their enamel. It strengthens the surface and provides a protective, mineral-rich layer. Because there is no chemical oxidation or dehydration, there is zero post-operative sensitivity. Patients should expect their maximum natural brightness, the luminosity of a healthy, clean tooth, not the artificial opaque white often produced by chemical bleaching. Contraindications: avoid use on patients with untreated caries, fractured enamel, or severe intrinsic discoloration, where professional bleaching or veneers are the only clinical solution. Not effective for deep intrinsic stains, for example, severe fluorosis or tetracycline staining. Inform patients with existing crowns or veneers that Whistle Glow will not change the color of restorative materials.